So let's talk about this in a little more detail about the diet component of preventing and, trying to halt and then eventually, in some cases, reverse heart disease. Can you describe what is this diet? What are the good parts, the things you got to avoid? So give us some details on this whole approach that you prescribe to your
Yeah.
patients.
So there has been a explosion. Everybody, wake up right now. There's been an explosion of data. I mean, there's so much data, it's ridiculous. I have some Google alerts and other internet alerts on new research on nutrition, and it's always being plant-based, being plant-based, being plant-based, or being keto is dangerous. Okay, so that's kind of the opposite of saying plant-based is good for you. And there was just a study published this week, and by the time this is out, okay, it'll be a little bit dated by a few weeks maybe, but over 100,000 women in the Women's Health Initiative, and since we're talking about women, higher plant-based diet scores, lower risk of developing heart disease. We see that over and over, but this was a massive, United States female-centered study. Simultaneous with that was more processed red meats, more heart disease. Same message over and over and over and over and over. Rambunctious little sucker doggies out there. And then you get to, I love this. Not a lot of people give a shout out to David Jenkins, University of Toronto, senior scientist, published glycemic index, glycemic load science, and then he published the portfolio diet. How many people listening today know the portfolio diet? It's actually not a diet, it's a tool, it's a biohack. If you want to lower your cholesterol, use plant-based foods, but he specifically had you do sesame seeds or sunflower seeds for plant sterols. He had you do soy-based foods. They could be edamame, tempeh tofu, a lot of oatmeal and oat bran, and a few almonds a day. And when he did this 20 years ago, he showed that cholesterol could drop 25% with adding these 4 foods. Anybody just look up portfolio diet. It's good research. Again, just this week, they looked at a giant United States female population. If your diet has those components in it, not only is your cholesterol lower, we learned that from Dr. Jenkins, a small study. In this big study, you lower risk of heart attack and stroke. These things are just different signals that say, the food plate you eat and I eat, fruits, vegetables, legumes, and whole grains, unless you're celiac, are the core foods or the only foods. For me, it's been the only foods for decades. And you can anticipate cancer risk. Today, a research study, men's prostate health and PSA levels. Okay, not a very female topic, but still an important topic. That's a unique one because we don't talk a lot, other than Dr. Ornish's prostate cancer studies in the 90s. We don't talk a lot about whole food plant-based diets and male prostate health, but new data says it works. Talk about brain health and Alzheimer's risk, lowering your saturated fat in your animal food intake. I mean, it's just and now all the plant-based and kidney disease data, we didn't really have much 15 years ago. So there's really not an organ system. What's the downside? Doing it with junk food or doing it without at least considering nutritional little mini deficiencies. Do you need some B12? I think so. Do you need some vitamin D3? I don't know. Check a blood test. Get some sunshine. But you might need some D3. And in the pandemic era, there's at least a few signals that say don't be low in vitamin D. Yeah, eat a lot of mushrooms might do it for you. So I take a plant-based multivitamin that has a little bit of D and omega-3 from algae and a little bit of B12 and a little selenium and iodine. But, I think that little trade-off. And the thing is, my impression is the plant-based community is the most honest and open. Okay, we got this great eating plan and a couple little deficiencies, and we know how to supplement or do it through natural foods if you want to try and do kelp and nori for your iodine. The general community doesn't talk that way, and the carnivore keto community doesn't talk that way because it's the perfect diet. So I think we've got the best of all worlds, and I don't buy into can't be a good diet if you got to take a vitamin. I think that's nonsense. I mean, Dr. Walter Longo, probably the world's leading nutrition expert at University of Southern California, take a multivitamin every other day. I mean, this guy knows more about biochemistry of food than anybody. That's not an unreasonable plan.
I love how, in general, you keep it simple, Dr. Khan, and you're citing a lot of research which is showing more plants, more plants, more plants. It's pretty clear. So
Absolutely.
when
Absolutely.
it comes to, heart disease and fat intake, what are your guidelines here? What do you prescribe to people when it comes to animal fats and plant-based fats?
Right. And I won't do my whole talk on why saturated fat matters and why you should limit saturated fat, going back to Dr. Ansel Keys and studies in the 50s, 60s, and 70s, because the database is huge. What I love to tell people, the most expensive cardiology research study ever published and completed was finished in April 2020, called the ischemia study. Men and women that had serious blocked arteries, do they have to rush to bypass and stents? Or can we treat them with medicine, some lifestyle recommendations, and some fitness? And the recommendation, and I love this, because turns out the results showed most people don't need to rush to bypass or stents. To me, incredible verification of Dr. Ornish, Mr. Pritikin, Dr. Esselstyn. Everybody's different, but it wasn't like, whoa, they missed the boat and everybody needs their stent and their bypass today. Most don't. What was the recommendation? Low saturated fat diet. And this is coming from, everybody that planned this massive international study. So it's a common theme. Where's saturated fat? In plants, we know it's coconut oil and palm oil almost exclusively. Olives, olive oil have some saturated fat, nothing like coconut oil and palm oil. So if you're eating no coconut oil, no palm oil, in either a low or no added oil diet, you'll have very little saturated fat if you're eating plants. But where is it? It's in butter, lard, ghee, cheeses, baked goods like croissants, all the meats, certainly more in processed marbled meats than super lean or wild meats. I'd suggest don't eat any of them, but you want to get saturated fat down. And and I know that may improve insulin resistance and return insulin sensitivity and get your A1C down and get your triglycerides down and get your non-alcoholic fatty liver, NASH, reversed. That's, again, beautiful data that Dr. Barnard's research group showed. So, again, just the entire body benefits.
Yeah, we all know trans fat is out. Nobody argues about that. But just like you said, the saturated fat is absolutely the culprit when it comes for certain insulin resistance. And obviously you talk about that a lot in your research about heart disease and what you see with your patients.
It's kind of funny. I just completed actually 2 courses on epigenetic medicine, genomic medicine. I just wanted to upgrade my skills. And some of my patients now will be getting swabs and I'll be getting all their SNPs back. Every time you do that, the message is, you've got a SNP, you should eat a lower saturated fat diet. Maybe it's ApoE4 and it's telling you. Maybe it's other markers. I've never seen one report come back that said you should add more saturated fat. So whether you do the genomic testing or not, it just seems that both the clinical science and this more advanced way to evaluate and be precise with patient recommendations, it's always leading ApoE4. If you got a family history of some Alzheimer's and maybe you've done a 23andMe and you find out, well, you need a lower saturated fat diet to protect your brain. I mean, we just see it from so many routes.
Yeah. Now, I think, again, one of the fun reasons to have you joining us is you do know a lot about testing. Like you've talked about a lot of different tests that I'm sure are brand new to people. You're on the cutting edge of these new tests, aren't even available everywhere. I mean, you have a very advanced medical practice that you work with your clients through.
I got a lot of patients. I mean, I am a real doctor in the trenches, 7
So
days
for people listening, I mean, I remember you were one of the first people I spoke with about the coronary calcium score, and I saw the movie Widowmaker, which is a great movie if you want to learn more about that, about the test. But you explained how easy it is to get that one. Maybe, is there 1 or 2 other tests? Like, people are wrapping this up here. Like, what tests can people get if they want objective information? Okay, where am I at? And what progress can they see in any of these tests?
Yeah, and you did a good service there. There is a documentary. You can find it on, social media or internet, called The Widowmaker Movie, probably about 5 years old. Very interesting. Recommend everybody see it. It's not a plant-based movie. It's a cardiology strategy to detect heart disease early. It's very compelling. That leads one to order a coronary artery calcium CT scan. In Cleveland, it's free. Isn't that crazy? If you go to University of Cleveland, they do it for you on free.
Wow.
Many places you have to beg your primary care doc to get a prescription to get it scheduled. Do it once, maybe age 45 would be a reasonable place. Blood work. Ask for that high sensitivity C-reactive protein like my patient going to see the specialty dentist. And I'm going to be a little commercial for a second, but just so people see it, ask for the lipoprotein A blood test. 20 to 25% of people inherit this from mom and dad. It's not good for your health. This is a book I wrote last year on the topic. You should find out if you inherited it and then read the book and we can talk about what to do about it. But it's always eat more plants. It's always a good one. The carotid study I talked about is called a carotid intimal medial thickness test. Just go CIMT. Little challenging to find. I do find places around the country, around the world for patients I have that aren't in Detroit. It's an option. It's a really great test if you can find a place that does it. Cedars-Sinai in LA, UCLA, they do a great job. Trouble to find it in New York. I do know a place in the Miami area that does a good job. And then finally, the fancy CT scan is available. It's called Clearly Health, if anybody wants to read about it. I'm not an investor. CLEERLY health.com. They should definitely send me a big box of arugula and avocados after that. Shout out. But anyways, that's really advanced. You got to work with your doctor and your health team if that's right for you or not. But I think those are the ones that I mentioned, But if you had one, get a heart calcium CT scan.
Perfect.
Unless you've had a heart attack, a stent, a bypass, you don't need it.
Right. Okay, that's what I thought. Just wanted to confirm that. I think that is definitely a great first step for people listening to this and saying, you know what, I don't want to be one of those statistics of the 1 in 3. So you can prevent this, and if you're
halt it,
yeah,
and you cannot have it, and actually find out. I've been taking Lipitor for 10 years, and my calcium score is 0, and maybe my carotids are young. Not just Joel Kahn, American Heart Association, Canadian Heart Association says you probably don't need that Lipitor. Talk to your medical team before stopping anything. But these tests don't always lead to more treatment. They sometimes lead to reassurance and less treatment.